The Acumed MINI-Calc plates are part of the locking Calcaneal plating system. To minimize soft tissue irritation while still providing a durable construct, the MINI-Calc plates were specifically designed to be low profile and target the quality bone in the calcaneus. The following surgical technique is Acumed's suggested method for implanting the MINI-Calc plates. Obtain lateral and axial views of the calcaneus, as well as a CT view of the sagittal and coronal planes. Contralateral extremity views may be helpful. Place the patient in a lateral position with the operative extremity facing up. Be sure that lateral, Brodens, and axial fluoro views can easily be obtained. Make a straight or slightly S-shaped incision from the base of the lateral malleolus to the dorsal aspect of the calcaneo-cuboid joint and dissect. Carry the dissection down to the subtalar joint. Retract the peroneal tendons posteriorly and plantarly. Be careful to avoid injuring peroneal tendons and the sural nerve during dissection. Use K-wires and the Freer elevator to provisionally reduce the posterior facet fragment to the sustentaculum tali or constant fragment. Ensure the angle of Gissane is approximately 100 degrees or equal to the opposite side. Place a Steinmann pin in the posterior tuberosity. Pull the tuberosity out of varus and back to length using the Steinmann pin. Ensure Bowler's angle is between 25 and 40 degrees. Verify the reduction under fluoroscopy. Provisional K-wire fixation axially from the tuberosity towards the sustentaculum along the medial aspect of the tuber will help hold your reduction. At this point, you may return to the posterior facet reduction if it was incomplete previously. It is usually easier to obtain anatomical reduction once the tuberosity has been pulled out to length. Insert the MINI-Calc plate through the incision and confirm positioning of the plate under fluoroscopy. Use K-wires or plate tacks to provisionally fix the MINI-Calc plate to the bone. Thread the locking drill guide into one of the locking holes located under the posterior facet. Choose the drill with a matching color band and begin drilling. When the plate is not seated directly on bone or lag effect is desired across the posterior facet, non-locking screws are used. When drilling for locking screws, depth can be measured by reading the laser mark on the drill through the tri-flat drill guide. Once proper drill depth has been achieved, remove the locking drill guide from the plate. Insert the appropriate screw. Repeat step 6 to insert the anterior process screws. If locking both screws in the anterior process, ensure that one screw be 10 mm or less in length to avoid screw collision. Use fluoroscopy to locate the posterior screw holes and verify the location with a K-wire. Make a stab incision over the hole through the skin only to avoid sural nerve injury. Bluntly dissect the plate and identify the plate hole. Thread the locking drill guide and drill with a matching color banded bit. When drilling, depth can be measured by reading the laser mark on the drill through the tri-flat drill guide. Once proper drill depth has been achieved, remove the locking drill guide from the plate. Insert the appropriate screw. Verify the reduction and screw placement under fluoroscopy. Close the wound in layers. For specific questions not addressed here, please contact your local Acumed sales representative or Acumed directly, either at 888-627-9957 or on the web at www.acumed.net.